This coronavirus special report starts now.
Good evening, everyone, and welcome to our special report on the coronavirus. I'm Mike Tang.
And I'm Dana Winklepleck. Tonight, we are here for you because we are stronger together. WTWO assembled a panel of experts to answer your questions concerning COVID-19. Of course, remember, for specifics, though, about your own health, make sure you check with your doctor.
Yes, absolutely. We want to introduce our panelists tonight. First is Mark Kielman. He's the Director of Quality and Infection Control at Union Hospital. He served in this position for the past 6 years. Beside him is Nathan Boyce. For the past 3 years, he's been the Chief Executive Officer at Regional Hospital.
And our next guests include Dr. Edward Rico. He is the Chief of Medical Staff at Horizon Health in Paris, Illinois. He also provides specialty care for those with diabetes or thyroid or hormonal disorders. And next to him, Adam Thacker. He is the Chief Operating Officer at Good Samaritan Hospital in Vincennes.
Also joining us tonight is Dr. Doreen Hoynicki. She's the Director of the Vigo County's Emergency Management Agency, and Ronnie Elder with the Vigo County Health Department.
So our first question for tonight goes for Mark and Nathan. There are 3 confirmed cases, of course, of COVID-19 in Vigo County. So are these people hospitalized right now at either of your facilities? Were they okay enough they could just go home and be quarantined? And people are also talking about precautions at hospitals. So what are you doing to make sure that patients and staff stay safe?
Yeah, I'll take that. At Union Health, we do have, as I think the public knows, we have 3 confirmed cases of COVID-19. And I'm glad to report that all 3 patients are recovering at home at this point in time and doing well. We're doing everything we can to help with this pandemic, following CDC very closely, Indiana State Department of Health, and all the recommendations that come to us. First and foremost, I think our core goal, our mission, is to provide care to patients whenever they need our services. At the same time, it's equally important during this public health crisis that we're able to protect our own staff and protect the community as well. So in a lot of ways that means innovation, really. So we're thinking creatively and how we can still provide that high level of care and at the same time keeping everybody safe. So I know everybody's familiar with the tent that's gone up at Union Health, and we're also looking at virtual visits and things of that nature to, again, provide the high level of care while keeping our patients, staff, and community safe at the same time.
And Nathan, similar things at your hospital there at Regional Hospital as well?
Yeah, absolutely. So we've tested about 24 patients so far. No COVID positive patients at Regional Hospital, thank goodness. So our hospital's been preparing, like many in the region, by limiting the number of entrances to the facility and limiting the number of visitors that we have in each of our patient care areas. And right now the attention is really on how do we prepare ourselves for the possible influx of patients that we might receive as a result of this virus. So it's everything from educating our staff how to protect themselves with the PPE or the personal protective equipment, and making sure we have ways to stretch our inventory as much as possible, setting up reprocessing systems, making sure that we have a tight control over our PPE and how it's being used. But again, it's about being out there in front of the caregivers, giving them the support that they need, and ensuring that they know that we're here for them and we're listening to their concerns and we're being responsive to it, and sharing with them the information that is coming out from some of the healthcare organizations nationally about how to best protect ourselves against this virus, both patients and caregivers.
All right, well, let's ask the same questions of Dr. Rico about Horizon Health in Paris. Doctor?
Yeah, at Paris Community Hospital and Horizon Health, we have a pandemic action plan which went into place in accordance with the CDC and the Illinois Department of Public Health guidelines. All patients as well as staff are screened as they come into the building every day, on the lookout for patients or staff that may have symptoms such as fever, cough, contact with a person with documented illness. That allows us to take the steps to try to protect our patients as well as our staff as we move forward.
And Adam Thacker at Good Samaritan in Vincennes, any cases of coronavirus being diagnosed or treated there?
Currently, we do not have any confirmed positive cases at Good Samaritan. We have tested a number of individuals and are awaiting the results on some of those, and we've had some negative results as well. As far as actions that Good Samaritan is taking, as you heard, there's so much coordination going on throughout the region, across our state, across the country, CDC. We have visitor restrictions as well, screening stations, working very closely with our clinicians to put together a plan for treating respiratory illness patients and have really focused on how we manage to send those patients to a specified clinic where we have trained staff that have gotten additional education in treating the COVID-19 infection and are able to help them. The majority of that care is able to be delivered in an ambulatory fashion, so really focusing on that care delivery model. Have moved our triage at our emergency department outside, all in an effort to identify patients early as well as protecting our staff, which is really important. Our incident command team meets twice a day for the last 3 weeks, every day, and discusses what we're seeing in the situation as it's changing and evolving on an hourly, even a minute-by-minute basis.
All right, thank you, Mr. Thacker. We'll shift our attention now to Dr. Doreen Hoynicki and Ronnie Elder. I'm sure both of you have seen an increase in your workload. We were talking about that before the show began. Can you tell us what it looks like right now and the roles that both Vigo County Health and Emergency Management Agency are playing in this, well, extreme time of need?
The Vigo County Health Department takes lead in the fight against COVID-19. We're the ones that will investigate the patient, which is something that we do all the time in our agency with communicable diseases.
And Dr. Hoynicki?
Our role really is to stand by our other our partners, which is the health department. As you can tell, the local health department, their chain of command goes up to the Indiana State Department of Health, and ours goes up to the Indiana Department of Homeland Security. Our job is really to continue what we normally do, but the expanded role, one of the most important things that we switch to now is resource management and helping our partners get the resources that they need, particularly working with all of our first responders, which would be fire, EMS, law enforcement, and some of our other health providers. So we work cooperatively with the health department, who's then working with our health partners.
Dr. Hoynicki, just a follow-up, you're telling me earlier, your people are on the front lines. They're the first ones to respond to suspected cases of coronavirus. What are some of the steps that you have taken with them to just motivate them and make sure that they're safe and know how to handle this?
Well, we work with the chiefs of the departments and the individuals themselves. We get quite a few calls regards what's appropriate use of PPE, reuse of PPE, personal protection equipment, when we might see those. And so we're working with, again, the State Health Department and the Homeland Security Department to see what are the actual needs, what are our actual resources, and then really trying to be uplifting with our folks, our first responders, just trying to tell them that, they're doing a good job. Our EMS and our firefighters and rescue, they're the first ones into the home. So sometimes we need to support them and let them know they're doing a good job, and then how can they protect themselves and their families. So we're there as a support to our EMS, fire, law enforcement.
All right, thank you, Doctor.
And we do want to point out that we have people spread all over the studio. We are social distancing here. So if you're looking at these camera shots thinking, wow, those people are far apart, there is a reason for that. We just want to keep everyone healthy as they give us this valuable
Imagine like a big dance hall and everybody's against the wall, separated. That's what it looks like right now. But they're all here saying some good things.
They are. Next question is for Mark from Union Hospital. So if someone is sick and they think they need to be tested, first of all, do you want them to just show up at the ER? Do you want them to call ahead? And who exactly can be tested? Because it seems like everybody would like to be tested.
Yeah, it does seem to be the question that's on everybody's mind is the testing piece. And I think the short answer to that is, I think it's important to remember that over 340,000 cases worldwide, and it's been proven time and again, over 80% of these patients recover just fine at home. So in that way, I liken it very similar to an influenza illness. And so with the question of testing being on everybody's mind, again, the answer is if you're mildly ill, you wouldn't go to the ED for influenza. And we really do. We're available for you to care for you if the need arises. But if you're mildly ill, we really do encourage you to call ahead, call your PCP. One of the options that we did go forth with at Union Health is we started the Union Health Hotline. So we are available to you, and we want to make ourselves available to you to answer your questions, help with the concerns that you have. But again, 80% of the patients that have this disease worldwide do just fine at home. It's not an easy answer, but chicken soup and Tylenol is the answer in a lot of the cases. So patients are doing just fine at home in much of the time. So,
all right, thank you for that.
Moving to Dr. Rico, once someone has tested positive for the virus, will they automatically be admitted to the hospital, or are there some other options, doctor?
I'll answer your question in this way, Mike. There is no plan, as was mentioned earlier, to do widespread testing of patients that don't have symptoms. Based on the current guidelines, if a patient has symptoms, fever, cough, sore throat, and they have other risk factors, if those patients are clinically ill enough that they may require hospital admission at that time, that would satisfy the criteria for testing. So it is true that the vast majority of patients will not be tested and don't require testing.
All right, very good.
And this next question is for Nathan from Regional Hospital. There is so much information out there. What is, I guess, the one or two things you really want people to know, because it just seems we're overwhelmed with stuff right now?
You know, I think it's really important to heed the advice of the governor today to stay at home. You know, I attribute this a little bit to like putting out a forest fire. You know, right now, especially in this part of the state, we have a narrow window, a small period of time here, but a very important period of time where we can sort of stamp this thing out and prevent it from spreading wildly, and that is by keeping a distance from each other. You know, this virus is highly contagious, far more contagious than the average flu. It spreads by contact and by droplets, and so if we're staying away from each other, we're keeping the 6 feet of distance, we're staying home unless it's absolutely necessary to get out and about. That's going to starve the virus and sort of smother it out before it gets much worse.
All right, thank you. We go now to Mr. Thacker from Good Samaritan Hospital. One of the most common things we hear from people who might not be concerned to some is this similar to the flu? And can you tell us a bit how this really compares to the common flu season?
Well, that lies part of the challenge, right? These are both viruses, they're both respiratory illness and can look and present in a very similar fashion at the beginning stages of the illness. Fever, cough, respiratory symptoms, shortness of breath, even some of the muscle pain related to that, overall feeling of tiredness. But a lot of those similarities then start to part when you look at the severity of the illness with the coronavirus, when you look at the transmission. So you heard previously mentioned it's highly contagious, 2 to 3 times more contagious than what the flu may be. And we're still receiving more and more information that's coming from the CDC, from global data. So while it's so early in this coronavirus development, we're learning more and more about just how it impacts individuals, but we know that it has a drastic impact on our elderly population, on population that are at risk. And so much of that is tied to influenza. We have a vaccine and we have immunities in our bodies because it's been around for a number of years, many years. And with this, it's a novel virus. So when somebody comes in contact with the coronavirus, there is no immunity to it. So your immune system is what's fighting that. And without those immunities, potentially increased risk for severe illness.
Yeah. All right. And this question may go to any of the hospital representatives here. And all the hospitals have limited visitors right now. Is that helping flatten the curve by just not having people visit the hospitals?
You know, I think it's probably a little too early. I don't know if there's enough data points yet to say whether we are truly flattening the curve or not. I think in some areas we're still probably in the steep part of the curve, but I do think that the advice is sound. And by limiting visitors, by limiting contact with others, we will begin to flatten the curve here. But it's going to take a couple more days to a couple of weeks before we really see whether we've been very successful and to see how successful we've been in that.
All right, and this question is for Dr. Honicki. So what do people need to know about statistics? We're seeing a rise in the number of cases here in Indiana and in Illinois. So is the virus spreading? Are more people getting tested? Or is it both? And do you think that there are a lot more people walking around with COVID-19 than we even know about?
Well, just like we've said previously, we know that this is a highly contagious disease. And you're looking at the numbers. We're testing, or those that are being tested are those that are showing more significant symptoms. So it looks like the data is skewed, but the ability to test has been ramping up. So as we have a greater ability to test, we'll obviously have more cases. The studies have shown right now that the spread rate is about a 1 to 3, so for every one person that becomes ill, they may be able to spread it to 3 other people. But again, the vast majority, greater than 80% of those, are either mild or subclinical cases. This is something that, this is where the social distancing, the staying home right now, the kind of shelter in place is so critical. I think this is the upsweep, and this is our best chance of flattening that curve. Again, just having people stay home, be reasonable, be a little kind, would really help right now. And so it's a very, very dynamic process right now. So as testing becomes available, I'm sure we're going to see obviously more positives. But again, that doesn't necessarily mean that those people are severely ill, and the vast majority can stay home and take care of themselves at home. So people are really hanging on the number of positive cases. Right now is we just have to be reasonable and watch those numbers.
Good advice. This has been the big story today. The governor in Indiana released executive orders, which means that most Hoosiers will have to stay at home beginning Wednesday or midnight until April 6th. You know, obviously people are going to have to go out and get groceries or other essentials and medicine and things like that from the pharmacies. How safe is that, first of all, going out? And because you know, people are being told to not to go out to different places, but yet everybody shows up at the supermarket. And then secondly, when they come home, what should they do to kind of protect themselves after venturing out? Or is that necessary? Mark?
Yeah, I think, and I think at this time, a lot of people are being very cognizant of cleaning. I've heard a lot of stories of people walking in and into their home and it smells like bleach, and I think that's great. The more the merrier. Some things I would encourage those folks to think about is really the high-touch surfaces, and not just in your home, but think about things that you touch all the time but often don't get cleaned. So that might be the handle on the car, the door of your car, it might be light switches in the home. All those things get touched regularly. I'm certain that there's not a countertop in Vigo County that has any virus on it at this point in time, because I think that's often the first one cleaned. But really kind of step back and think about the other things that you touch on a regular basis, where if you've not been diligent about hand hygiene, soap and water for 20 seconds at least, other things that you touch that you might be transmitting a disease through. So.
And now let's talk to Ronnie.
Yeah, Ronnie, what's your view on that? How safe are people going out to supermarkets and then coming home? You're part of the task force here.
We're really encouraging people to only go out if they need to. And if you're in the high-risk category, try to stay home, get someone to get those groceries for you, do the delivery services or the curbside pickups for the groceries. If you do have to go out, it's okay to go out. Just be careful, be cautious of people, stay 6 feet away from them, don't touch your face, and wash your hands. As we've talked about, when you get home, you've touched so many things at the grocery store, on your way home, the doorknob to get inside. Just wash your hands before you eat or touch your face once you get home.
And we should point out that Ronnie with the health department was one of the first people to tell us, wash your hands.
Wash your hands, yeah.
That's right. All right, we would also like to go back to Mark now, and we would like to talk a little bit about the importance of the COVID-19 and for people knowing that this is not a death sentence, and how long, though, would it take for someone to recover? So if you do get this, we've heard that it is, you have symptoms, sometimes you can just stay home. Yeah. How long, though, would it take from those first symptoms for you to recover?
Yeah, so I would say there's still information pouring in on that, but it'll be very similar to the flu in that regard. It's important to know that the incubation period, it'll be listed anywhere between 2 and 14 days. So from the point that you contract the virus to the point you become symptomatic. Oftentimes people are saying, a lot of the studies out of China, 6, 7, 8 days, somewhere in there for the incubation period. And then once you become symptomatic, from that day one or forward, it's anywhere between 10 and 14 days, depending on the severity of the illness as well as the other health conditions that people have with them when they do contract the disease.
And Dr. Rico, kids are home. across the states, in Illinois and Indiana. A lot of kids wanting to be with their friends. How safe is that to have their friends over?
Yeah, Mike, that's a very difficult problem for kids of all ages, elementary school through high school and even at the college level. They're used to social interaction, they're being deprived of music, sports, normal activities that they enjoy, that they interact with other people. But the key here is, the whole issue behind the social distancing is trying to interrupt the transmission of the virus. So whether it's through respiratory spread with droplets or with airborne viral particles or direct person-to-person contact. So I think it's okay for kids to go outside. It's probably best that they avoid groups at the playground.
Yeah, I was going to ask that about being outside because the weather, Jesse's weather forecast shows that it's going to be a little nicer. That might be good for people to go outside, but I know some places around the country, they're closing parks. They just don't want people congregating. Is that right, Mr. Thacker?
That's correct. We've seen a number of venues closed, even some that are outdoor, and it all gets around to the gathering and trying to keep everybody safe and those social distancing parameters that have been set, whether indoors or outdoors. Those are practices that we should all be adhering to.
I have a question for Dr. Honicki. We hear these viruses that can live on surfaces and things like that. Does the coronavirus live on some surfaces longer than others? How long can they live on a surface? And what's the best way to clean these surfaces in our homes? And of course, around here at work, we have a lot of communal spaces. What should we be doing with those?
Well, some of the studies have shown, yes, that on different surfaces, different contact surfaces, the virus can live different terms. Surprisingly so, we found that the longest that it stays on is something like stainless steel, which is a little counterintuitive. We think it's not going to stay there. It can on plastics, 24 to 48 hours. Some of the studies that they've done have shown that the virus still can be on even something like cardboard for up to 24 hours. The thing to remember is that on those surfaces, they're now doing some of the studies saying just because there's virus there, is there enough virus that would cause illness? The other thing people have to realize is how you use products. Most of the products that we use, say we're using Clorox type wipes, is when you wipe, you should wipe in one direction, and it's very important to let most of these products air dry. It's the air drying and the contact time that gives us kill time for viruses. Products that are recommended, obviously the commercially made hand cleaner can be used. A straight isopropyl alcohol or rubbing alcohol can be sprayed on appropriate surfaces and allowed to air dry. The commercially made products obviously are doing well. You can use a 1 to 10 bleach solution, but you have to be careful what surfaces you spray it on, particularly your clothing. It may damage your clothing, so you want to look at labels. And then also a 0.5% of peroxide can be used. Again, it's the idea that when you spray, let it sit. If you have to wipe direction. Do not wipe it to where it dries. The most importantly is using the contact time and air drying for kill time.
Now that was some important information because I'm always like this.
Yeah.
That's the wrong way to do it. It
Right.
sounds like it's like this. Is that right, Dr. Honicki? One direction, okay.
Talk about if you're scraping crumbs off a countertop,
Yeah.
do it in one direction. Don't swirl it around, one direction. Again, the dry time is very, very important.
I wonder how many of us have been doing it wrong.
Yeah, I have for a long time.
Yeah. Thank you, Dr. Honicki. Mr. Voies, we hear stories daily about medical professionals working long hours with little resources during this pandemic. What can the average person do to help the people and support the people who are on the front lines during this pandemic?
Well, medical professionals, they are a special breed to put their lives on the line and go out there every day and dedicate their professional careers to improving others' health and well-being. I think, saying thank you goes a long way. I think adhering to the guidelines that we hear is probably the best way that you can honor your healthcare professionals is to listen to the requests of, in Indiana's case, of the governor and stay at home. Do the smart things to help prevent the spread of this disease. But also, healthcare workers are just people at the end of the day. They have families. They have concerns about their own health and the health of their family. So check on them like you would any other. If there's something you can do to make them feel more comfortable, make their family feel more comfortable in their their absence. I think those are the types of things that all of us should do to take care of each other.
And I do have a question for Dr. Rico. You know, you and I were talking earlier about, we've seen that this virus is bad for people over the age of 60 and really bad for people over the age of 70. Can you talk a little bit about why that is?
Yeah, thanks, Dana. We know that as patients become older, their immune response wanes. In many cases, these are the same patients who are experiencing chronic disease processes, coronary artery disease, chronic obstructive pulmonary disease, congestive heart failure, and so forth, that further impairs their immunity, their ability to fight off the infection.
You know, we were talking earlier about if you do get COVID-19 and you're staying at home in quarantine, with acetaminophen, chicken soup, anything else, Dr. Rico, that you would suggest that people take to help relieve symptoms?
Keeping up with fluids is important. It's easy to become dehydrated if you're not involved in your normal activities. Some of the current recommendations suggest that the use of acetaminophen in preference to ibuprofen may be beneficial when it comes to the COVID-19 virus.
All right, thank you so much for that.
We're getting a number of questions on our Facebook page about whether or not this is going to reappear later this year. Do any of you have any information about that? Nobody? You do?
Well, I can speak to what our discussions have been at Good Samaritan as we're doing everything, preparing for really the first influx or wave, if you will, of COVID-19 in the region, and how we prepare, and social distancing and all of the efforts that have been mentioned certainly are important. As we look at some of the information that's coming out of China, since they have seen a few days without any new cases, and then we're starting to see an influx as travel picked up and some of those pieces. I think what's really important is a second wave certainly is possible, given that our communities don't have immunity to this virus. So the hand hygiene, all of the pieces that we're talking about are going to need to remain in effect until CDC and a number of organizations really come out with a longer term plan as to what treatments or, certainly vaccines, which could be well down the road, are going to be brought about.
Mark, Facebook question, is this the same virus that came through last year? This was a Facebook question.
The virus that came through in November and December, they wanted to know if this is the same or was that something different?
Mark.
Yeah, it's a good question, and I think one that a lot of people would want answers to. Unfortunately, the reality of it is, while I'm not going to say it's not possible that it was, we really just don't know the answer. At that point in time, we didn't have the capacity to test, and I believe it was December 14th or so, even in China, when it was first starting to be identified. So it's possible. I don't know the answer. Dr. Hornicke, I don't know if you can speak to it.
We do know that unfortunately when the virus was first discovered, or the rest of the world was advised of the presence, the first cases, I believe, were first documented in China in, I think it was actually November 19. And then as it progressed, they weren't aware that they were having an outbreak, and that wasn't until December. You have to realize that during that time of year, November, December, January, actually February and into March, that is our typical seasonal flu season. So although many people aren't tested for seasonal flu, influenza type A, type B, we don't have a good handle on how much was actually the COVID-19 or was it really seasonal flu. We'll only know after a period of time, perhaps, what that overlap was. But first cases were identified about mid-November in China.
Talk to Mr. Voice real quick. We were talking earlier about resources here in the Wabash Valley. We've heard about shortages elsewhere. How are we doing? How is Regional Hospital doing?
Our hospital is doing rather well. Certainly we have an inventory on hand of all the PPE that we're going to need, but the real variable in this equation is how long we're going to need this level of protection. And so we're putting things in place like reprocessing our face shields and goggles and eye protection and putting those back into use. We take daily inventory of all of our PPE. We're monitoring it very closely. We're making sure that we stay within the CDC recommended guidelines for the use of that PPE, but also not being wasteful with it by any means. We have to conserve this as a precious resource because we just don't know how long we're going to have to use it. And fortunately, last week we received our first shipment from the Strategic National Supply, and although it was relatively meager overall, we do know that they'll be releasing more in the future, and we certainly hope that we'll be able to receive more and replenish our stock as we continue to use those.
This is a question, a number of people, many people are taking this seriously and they're taking the needed precautions, but there are a number of people out there that maybe don't agree with all of this. What would you say to them about the seriousness of this pandemic? Let's start with Mr. Thacker.
Sure. I think I would say that if you end up getting tested for COVID-19 and test positive, and public health officials come to you asking who all you had contact with around the spread of the disease, will you feel good about yourself if you had contact with a number of individuals and some of them may end up hospitalized?
Dr. Rico, the same thing. I mean, there's so much uncertainty about this. It's a fluid situation, so it only stands to reason some people are skeptical. They're always skeptical, big government coming in. What would you say to them?
Again, we know that the vast majority of patients that will be affected by the COVID-19 virus will be either with mild disease or perhaps even asymptomatic. And that makes these measures with the social distancing even more important than what we realize. Because if the risk of transmission is something like one person can possibly transmit to 3 other people, if that can be cut down to 2 people or even just 1 to 1 or hopefully 1 to 0, that can make a huge difference over time. So that's why it's important. Mr. Boyes, I understand you have a comment.
Yeah, I'd say, skeptics who don't adhere to the guidelines right now could be really setting all caregivers back in this fight against the COVID-19. Part of what makes this so dangerous is that you can be contagious for several days before you actually start feeling ill yourself. And so while you're not feeling sick, I think it's much easier for you to question the science and question the protocols. But at all that time, you're spreading this virus around and infecting 2 to 3 people wherever you go. And I think that's really dangerous. That can really set us back. And skeptics really need to think twice about this. We really need, all communities need to take this very seriously, and they need to put into place the protocols that we're being asked to do because they're common sense, and they are going to be what gets us past this and what gets us to flatten this curve.
All right, thank you for that. And Mark, we have a question. Someone wants to know what the difference is between upper and lower respiratory issues.
Yeah, so really one of the core differences is just the site of the infection, obviously. From a symptom standpoint, when you think of an upper respiratory tract infection, it could be a sore throat, it could be a runny nose, it's all part of the respiratory tract. Oftentimes a lower respiratory tract, and that's what COVID-19 is a lower respiratory tract infection. It's a cough, and it's not a productive cough. So it's not something where you're coughing up mucus. It's a dry, non-productive cough. And so that really is one of the fundamental differences between the two.
This is a question for Ronnie. If someone does test positive, what can they expect in terms of dealing with the health department?
So once we get a confirmed case, we notify the patient if the hospital hasn't already or whoever tested them, and then we will ask them for a list of people that they have been around. We will contact those people. If the people need to be quarantined, we will keep track of them, make sure that they're not having any worse symptoms, or if they're hospitalized, we'll be in communication with those entities as well. Constant communication with everybody involved.
All right, and Dr. Honicki, you and I have spoken many times over the years, so we've both been around a little while. Have you ever seen anything like this before?
This is unusual. What I would really like people to think about is, if you were alive and you remember 9/11, we all remember 9/11, but do you remember 9/12 and 9/13, how people really came together to support and help each other? The behaviors, some of our young people really need to take this seriously. We have reports out of Florida where people meeting on the beaches and some behaviors that we wouldn't probably like on a good day, but with this is more and more important. Really, to be kind to each other. You can go into the supermarkets right now and people are really somewhat hoarding their supplies. So in an effort of kindness, we are telling people, yes, stay home. But if you need to go to the grocery store, you need to go to the pharmacy, go in, get your supplies, and come home. There is no need to hoard. And I don't know the issue about toilet paper. There was a truck stolen in North Carolina that they recovered with 18,000 pounds of toilet paper on it. So this is unusual. I've never seen people really respond to this. When we look at other acts and other incidents and natural disasters, people are used to seeing this. But when we start talking about their health and we add something like a fatality rate to it, then that tends to get people's attention and higher concern. But again, it's very, very important to be reasonable, be aware of your surroundings. But I can ask, most importantly, try and be kind. This is a huge time. We're Americans. We help each other. Let's keep doing that.
All right, thanks for
All right,
that.
thank you, Dr. Hornicki. We're talking about COVID-19 and trying to prevent it and trying to treat it. But with this and the shutdown and everything, it creates stress, anxiety. What steps are your various institutions taking and organizations taking to help people who are dealing with that kind of, it can turn into a medical issue? Dr. Rico.
Mike, in our practice, as part of the overall pandemic plan, we've really cut way back in the outpatient environment. We've cut back on well patient visits. So again, in an effort to protect the patients as well as to protect our staff. But we're still in the office. That's true for all of the physicians, all of the nurse practitioners on the outpatient side. So we're trying to support the patients the best we can over the telephone, by computer. There's been a lot of interest in the last, say the last week, with exploring other opportunities for communication, telehealth, video conferencing. So we're still trying to do the best we can to support patients as well as our staff within these constraints.
Yeah, Mr. Thacker, I'm sure that is something that you've discussed, because the virus, everybody's talking about it. You can't get away from it. So an institution like yours, it must have resources to help those people, right?
Yes, we have employee assistance programs, and we're looking at how to ramp those up, how to make those available. We also have a very strong behavioral health component to our organization, because while our healthcare workers are certainly impacted to a high degree, and we don't know to the extent of what's at this point, but also to our community, to have those resources available, whether that be virtually or whether that be in face-to-face activity, but making those resources available, working with our individuals. We have a task force that's looking at how we can continue to have joy in the workplace and keep a strong morale even amidst a very stressful time.
And how about Union and regional hospitals? What's happening there to help keep people, I don't know if the word upbeat is the word to use, but at least less stressed?
Yep, so similar things to what Mr. Thacker said. We're looking at workforce engagement and trying to communicate regularly, keep the workforce informed on what's going on, both on the national, state, and even the local level as well. And then for the patients, again, we have the hotline. We want to be available, but where possible, we want to be available from the distance. The reality of it is public health isn't always convenient, and so we're trying to make ourselves available when our services are needed. But we are trying to, again, protect our staff and do what's best to help get everyone through this. It's absolutely a group effort, and I think we're making a lot of good progress. We just have to maybe even ratchet it up a little bit more.
Melissa from Facebook writes in, people who are in a immune compromised situation, what is the rate at which they're getting rid of this without issue? Is that a question that can be answered here? Anyone?
Well, I'm not sure we have enough information.
We don't have enough information on that one.
Question.
Okay.
But again, if patients have relatively mild illness, from that standpoint, it doesn't really matter if it's documented that they're COVID-19 positive or not. We would encourage those patients to exercise caution and remain at home and go through kind of normal supportive measures.
Tylenol, that seems to be prescribed more now than ibuprofen. Why is that? Doctor?
I don't know that we have a great answer for why it's thought that perhaps ibuprofen might make the patient more susceptible to infection. I'm not sure that we have, great data behind that.
Okay.
Well, we do have a question. Somebody wants to know how many test kits are available in the Wabash Valley. Could each of your hospitals kind of tell us how many are available? We'll start over here with Mr. Thacker.
Sure. So I guess I'll answer it. It's not necessarily how many test kits are available. There is an algorithm by which testing gets approved. So as we see patients coming to our organization, they are assessed for the symptoms related to COVID-19 as well as other risk factors. And if they meet the criteria, they can be tested through the Indiana State Department of Health, and we work closely with them to get authorization to test them. That generally is reserved for patients that are of higher acuity or sicker, such as requiring hospitalization, or our healthcare workers. We also have another path through our own commercial testing, and so but we're following similar algorithms, because testing on a national scale, while I can't tell you the exact number available across the Wabash Valley on a national scale, we know that that is something that is of shortage and is being worked on feverishly to be ramped up.
And is it similar in Illinois as well? I mean, if someone really needs a test, can they get one, Dr. Rico?
Yes, Dana, we're following a similar scenario where patients that are ill enough to perhaps require hospital admission, who have characteristic symptoms. The Illinois Department of Public Health has been very responsive with making lab testing available. The turnaround time is very good, 1 to 2 days in most cases. And we also are having some experience with private commercial labs coming up to speed. But the state lab through Chicago and Springfield, as well as Carbondale, the response is very good.
And Dr. Honicki, there are a lot of EMA sites, a lot of rural hospitals all across the state. How important is it to flatten that curve, especially for the rural hospitals around the Wabash Valley? Is it more important that we have that flat curve for those hospitals compared to the big hospitals, or do we just need a flatten of the curve everywhere?
We really need to flatten that curve. Rural hospitals may have a little bit more difficult time getting resources, but it's very, very important to flatten the curve. All I can do is point you to New York and the large, dense population areas, people living closer together. It is absolutely critical that we flatten the curve. So we need everybody on the same page. So following the guidelines of the social distancing, stay home as much as you possibly can. This is going to continue to be very dynamic. We'll know after about 2 to 3 weeks where we're at. Right now, the guidelines from the governor was until April 6th. That's not 100%. We may have to extend that, and it will just see what the numbers are doing and how well are we doing social distancing, and that's where we really need everybody on board. So from the very rural hospitals to the hospitals in the very high dense populations, it's crucial that we follow these recommendations. We can flatten the curve if everybody comes on board and does the same thing.
Mr. Kyleman from Union, you wanted to respond to this too?
Yeah, just specific to the amount of testing that we have available. We do have testing available at Union Health, but similar to Good Sam, it is limited. And what we do know for sure is that if we test everybody that unfortunately once tested at this point in time, we would probably be out in a matter of weeks, when the reality of it is, as Dr. Honicki just mentioned, we're still on the upward trend in terms of the number of cases. So it is important, and again, I think it's important to remember that for the younger population without the chronic health conditions that put you at a higher risk, even with a test result, the treatment's going to be the same. It's not going to be any different. Go home, hunker down, and manage the fever with Tylenol. So we really need to reserve the test for the elderly patients who are at a little bit more higher risk, where we really and truly do need to know the answer to help direct care.
What about masks? We've seen a run on them around the world. Should we be wearing masks? Who should be wearing masks? Are they helpful? Mr. Boyce.
Great question, and one obviously that people are asking all over the place. So I'll speak for the hospital in general. When the patient comes in with some of the symptoms like the fever, shortness of breath, or the coughing, we want that patient in what's called a level 1 surgical mask just to kind of contain what it is that they're coughing out. And then our caregivers, based on the severity of the patient illness, as well as any sort of aerosolizing procedures that the patients are going through, we'll wear anything from what's called a level 3 mask to an N95 mask, which is really sort of the gold standard as far as masking goes. So great question. The guidance changes as the CDC releases sort of a loosening of guidelines to help preserve our supply. But out and about in the public, I don't see a lot of people wearing masks right now, and I think with some of the other precautions that we should all be taking, I don't know that wearing masks right now is really the best advice to be giving.
Okay. Question. Okay, so Illinois has a lockdown, basically, stay in shelter. Indiana likewise. If we flatten the curve and people go back to work, is there a real chance of this thing spreading again? Because I'm not a scientist, but I don't think you're going to get rid of the virus immediately, correct? Dr. Rico?
Right. We won't know the answer to that question, I think, for certain until we have a viable vaccine.
Which is a long ways off.
I mean, there's phase 1 clinical trials that have started recently, but realistically, it's probably 12 to 18 months away.
Yeah.
So still a ways
A
away.
ways off. This is another question. Oh, Dr. Hoenigke, you had a response to that?
And I think I agree with Dr. Rico. One of the things that's why it's important while we're watching the 2 week of pretty much a shutdown is we want to see what impact we have on flattening that curve. And so again, this is a very dynamic thing. So I want people to realize that yes, in this state we're trying to socially distance, have people stay home until April 6th. And as we get closer to that date, we're going to be monitoring those numbers. So it may not be surprising, number one, that that's extended, or if we have a flattening of the curve and we loosen some guidelines, if those numbers begin to go up again, it would not be unusual to say we need to draw back and we need to go back to a more social distancing. And again, a reminder is just because we're social distancing and asking you to stay home, we're not asking you to isolate yourself. One of the things for mental health is, there's a lot of suggestions out there. Call your friends, call your neighbors, write letters, use the good part of social media to reach out and talk to one another. It's Skype and those type things are really great things to do. So again, as we work through this next 2 week period, we'll get some better numbers. It's very dynamic and it's very fluid, and that's why it's important for us to watch that, and we'll see if we get what we all call a double bump. So time will tell.
And something else that people can do just to be kind. I mean, Dr. Hoenigke keeps talking about kindness. I love the fact that you point that out. That's wonderful. Yeah. But if you have a neighbor who's elderly, or maybe even your parents, go shopping for them, leave their goods on the front porch.
Yeah.
You don't have to see them. You can just wave from afar.
Reach out and touch them, but don't touch them. Yeah.
Yes, reach out with your heart, right?
Yeah.
We would also like to know a little bit about the preparations hospital made. We talked about the tent and different things, but are there special areas in each hospital that if you had to have someone come in and be treated for COVID-19 and they need a respirator or, extreme care, are there designated areas in each hospital for that to happen? So let's start over here again, since you're to my right, to Mr. Thacker.
Sure. Yes, at Good Samaritan, we have designated areas, and we've really worked through a 3-phase approach as patients are contacting our triage line, having a virtual visit with one of our providers, or if they show up to one of our locations, that there's a screening process, and then we have the virtual medicine, of course, the respiratory clinic from an ambulatory standpoint. If there are patients that need to come into the hospital, our teams have been working to prepare specific rooms that are designated for coronavirus patients with the special precautions, such as negative pressure rooms, as well as conserving our PPE also helps us we help our conservation of PPE from isolating to certain rooms, as well as training of our staff. So from the first touch point all the way through to potentially a patient needing to be in our ICU, we have plans in place to keep COVID patients that are confirmed positive or suspected in certain rooms, and that helps to protect our healthcare workers as well as decrease transmission to potentially other patients that are in the hospital.
And Dr. Riegel, how about at Paris Community Hospital?
Yes, we're experiencing a similar situation there too as part of our pandemic plan. Every patient that enters the building is screened for symptoms. The staff that are involved in that screening, they have the full personal protective equipment. So of course they have no idea of knowing whether the patient has symptoms or not when they first come up. And again, that's key. Any patient that has symptoms that are potentially concerning for the COVID-19, the important first step is to get a mask on that patient. That helps to contain the spread of respiratory droplets or aerosolized particles that could potentially spread the virus.
And Mark, you're probably the biggest hospital here, Union Hospital. How about you guys? What are you doing?
Yeah, a lot of the same things at Union Health. We went from over 18 entrances to the different buildings down to 3, and we have screeners similar to the other facilities. And then we're really looking at traffic flow. So if we are going to test a patient, we're having them come through a different entrance into a special isolation room in the emergency department, for example, and then we'll put them up on designated units where we're caring for the patients while the test results are pending.
All right. And Mr. Boyce.
So obviously the ideal place to put a patient that might be COVID positive would be into negative pressure. Certainly once you run out of that resource, you want them in a private room. We spent much of the last 48 hours actually building sort of segregation units, temporary areas where we'll put patients. We've been putting up temporary walls, and we'll be cohorting those patients in private rooms behind those walls to really try to limit the interaction with the general population, but also to help us conserve our PPE, because our caregivers will be able to go into those areas and take care of those patients in a way that's much more efficient with the supplies that we've got.
And Dr. Hoynicki, you had a comment on this as well.
Yes, and don't forget that the healthcare many times starts out the home and in the public. So if you are using the 911 system, you may be asked by the dispatcher those type calls and those type things. So if you're calling to say you're sick or you're short of breath or having chest pain, it's not unusual to have that dispatcher ask you, have you had a travel, have you had cough, fever, chills, and have you have shortness of breath. They will then give that information to our first responders that are responding. And our responders are trying in the best way possible to do some distancing. So as a team responds, you may have one member go in first to see and reiterate those questions, and if there is a concern that they may be having symptoms of COVID-19, they will very frequently be handing that patient a surgical mask to put on, or the family member to put it on the patient, again, to try to dampen down spread. So our first response agency will be following those guidelines as well. And we're asking patients to please answer those questions, answer them honestly, so we can help you, help us to help you.
All right, and Ronnie, I know that the Vigo County Health Department kind of took the lead on getting a joint commission together. Can you explain just a little bit about what this joint commission is and why it's so important for people here in the Valley?
So we met with all the organizations, a lot of them that are here, and we decided that we needed to have a joint information center. So we have an email set up. Many organizations are on there that need to be updated constantly. They email us in, and we update our website every afternoon with any updates they have or any helpful links that the public needs to know. We also have a section on there that says number of cases, number of recovered cases, and number of deaths in Vigo County from COVID-19.
Insurance, people with health insurance, medical insurance, has this situation changed at all? Because has COVID-19 changed the way that insurance companies are responding? And what about the uninsured? Should they be afraid of seeking medical help? And what can you do? What can you do as medical facilities to put their minds at ease? Mr. Thacker, first of all.
Yeah, so related to insurance, across the nation, we've seen businesses and organizations step up in new ways. A number of our partners that are insurers have relaxed some guidelines that have allowed us to practice in a way that has been able to deliver healthcare, whether that be virtually or to bring in providers that, from a state licensure standpoint, there's been a number of waivers, and the state has worked very hard on that. We've seen that from a federal standpoint, and many insurers have gotten on board with that as well. As far as uninsured, Good Samaritan is a not-for-profit community hospital, and we provide care to all that come in looking for service. So wherever we can meet a need, that's our patient-first mentality always comes through when we need it to, and caring for individuals is why we're here.
Mark from Union Health, you had a response to that?
Yeah, I would echo a lot of the same in that at a time like this, when it truly is a national crisis, it would be a shame to let some of the nuances of the industry, as they are from a payer perspective and insurance, and some of the things we battle year in and year out, hold us back. And I am grateful that some of that has been lessened. Some of that red tape has come down a little bit, so that we're truly able to provide care to patients when they need it. And then similarly, again, at Union Health, we're not for profit. Regardless of ability to pay, we're here to serve the community.
All right, that's good.
First of all, I want to say these folks have done a fantastic job.
Absolutely.
And as we're wrapping things up, we want to just go around to every panelist for your final thoughts on what you think people need to know about COVID-19. So again, you're my favorite first start, Mr. Thacker, so here we go.
All right, well, I will keep it short and sweet. So you have heard a lot this evening about flattening the curve and what the community can do to support healthcare. So as healthcare providers, we're there day in and day out when somebody's sick and in need of healthcare to be delivered. But it's not very often we're going to ask you to do nothing. So stay at home, hunker down, don't go out. Practice everything that you're learning, and the catch of it is, if we do that really well, everybody in a number of weeks will be completely underwhelmed because we won't see the spike that many other countries have seen. So that's my parting piece is do nothing and follow the guidelines that you're hearing from your local healthcare providers.
And Dr. Rico.
Yeah, again, we know that the vast majority of people who are affected by the COVID-19 will have, mild disease, and that's on the order of about 80%. So many people may have, mild symptoms. Some patients may be affected by the virus and have no symptoms at all. We know that the recommendations are effective. We know that the social distancing works. We know that being cognizant of maintaining a clean environment, we know that's helpful with regard to limiting the spread of the virus. So,
Mark from Union Health.
A lot of what's been said already. I'm very appreciative of what the community has done so far. When I was driving home from work this evening, it was rather eerie coming down 3rd Street and the limited amount of traffic that I encountered. So I think we're off to a great start. I would encourage the community to continue to challenge your neighbors, challenge your friends, shame them if you have to. Continue on with the social distancing. That, in my opinion, is the best offense of what we have in front of us. Antibiotics aren't going to work. There are no antivirals that are proven effective for this. So social distancing, help us help you. Call us if you need us. We're there. But until then, stay away.
Mr. Boyce.
Very similar sentiments as my colleagues have shared here. I think I want to reiterate there's a very narrow but very real window of time here where we can make a real impact on the spread of this virus. And so I just urge everybody to follow the guidance. Wash your hands, don't touch your face, keep your distance from others, and certainly stay at home as much as possible here. And with any luck, we'll be able to keep this virus from spreading uncontrollably here in the Wabash Valley.
And Dr. Hornicki, do you have anything that you would like to add?
I echo what my colleagues have said about, staying home and social distancing. But I'd like to encourage people to take that time. Parents, get to know your kids. Pull out a board game, play some cards. This might be the time to actually really write a letter and mail it. You can go to the mailbox. Use the good part of social media, and so you reach out with friends and family and perhaps people you've thought of them and thought, you know, one of these days I'm going to reach out to them. Well, maybe this is the time. This is a great time to learn how to sew on a button, cook around the house. So use this time not as punishment, but get to know each other a little bit from a distance, say hi to your neighbors, but use this, like I said, people, you know, reach out, teach each other some life skills. This is a good time for families just to be families.
You know what, I think that goes back to our anxiety and, you know, being mentally healthy, just helping one another out and just trying to make a positive out of this negative situation.
And I also think there are a lot of houses that are more clean, they're cleaner now than usual.
That's probably true as well.
Cleaning out those things. Ronnie, any parting words from you?
Yeah, we know this is a financial hardship for a lot of individuals and a lot of businesses in our community, so we want to get this taken care of so we all can go back to work, support our small businesses in our community. So stay up to date. We're trying to update you guys as much as we can. All of us are working together. We want you all to have up-to-date information and really be right there with us in this fight.
All right, thanks so much for that, Ronnie. We appreciate it.
I think right now we're going to show the worldwide map showing the spread of coronavirus. You can find this online. Johns Hopkins, you can find Johns Hopkins Hospital has this, and you can keep yourself up to date. We will continue to keep you updated about the coronavirus. We're keeping you posted on the latest developments, local, regional, and national levels, and you also find the latest data from the CDC.
So thank you so much for joining us. A big thank you to all of our panelists. If we had an audience, they'd be standing up clapping, no doubt, right now.
But they wouldn't be shaking hands.
That's right. And remember, we are stronger together.